Usually when we meet our patients who are having heart disease or heart-related presentation, we meet them in the emergency room because they're just not feeling well. Tom had started not feeling well the night before, and he came into our outpatient EKG area to get just a routine electrocardiogram.
As I'm getting the EKG test done, the nurse just kind of has this blank stare on his face. So he runs the test again and turns and says, "I need to show a doctor." Dr. Matthew Cuddy walks in and asks, "Are you sure you're not feeling any pain?" I said, "Well, I have pressure on my chest and on my back." And she looks at me, "Because you're having a heart attack right now." So literally 15 minutes later, I'm off to surgery, and a half hour after that, they have a stent put in.
We were able to open up the blood vessel almost right away, and within a matter of minutes, he was pain-free, he felt great. And once he had the procedure, he realized exactly how much he had been suffering.
I refer to it as like an Indianapolis pit crew. You're at a motor race and the car pulls in pit row and everybody's out there doing their job. And that's what it reminded me of. It was, people coming left and right, doing what they needed to do to get it done. And it was incredible.
I was having terrific headaches. My blood pressure was 200 over 110, and it would not come down. So I came into the ER and went through all kinds of tests and stuff. And then I ended up going to a cardiologist, and they did a stress test, and I could not begin to even pass it. And immediately took me over to the hospital and ended up having triple bypass.
Kathy had a unique problem in the fact that she had multiple blockages. She didn't just have a simple blockage, she had multiple blockages in each of the arteries, which creates a very challenging problem. Something that you can't treat with stenting. You need to have open heart surgery for that.
Dr. Lee introduced himself to me and told me that he would be doing my open heart surgery. He was very professional about it. I was impressed with him. Actually, I was very confident that things would come out the way they were supposed to. All of the doctors and nurses that I encountered were very great, worked great with me.
She recovered very rapidly, and we saw her in follow-up, and she says she feels great.
As far as heart disease is concerned, prevention is key. So if you can work on things like making sure you're physically active, at least 15 to 30 minutes, at least 5 days a week, making sure you eat as healthy as possible. And if you are a smoker, working hard to quit smoking as much as you can. Those are things that you can do to make sure you decrease your risk of having heart disease or heart attack later on in your life.
If you question whether or not you might have high blood pressure or cholesterol or any heart-related conditions, look back in your family history, because it will tell you that maybe there are some things you need to get checked out.
Years ago, like when my mother was sick, there was absolutely nothing like this even available. And back then, you didn't have a choice about living or doing anything different. Being around for your kids or grandkids. I guess I feel lucky that we have the chance and the availability to do the things, and sound like it's getting easier and better for anybody that has heart problems.
I guess I'm just living for every day, just the chance to see my kids grow up. My wife and I can celebrate our 25th anniversary. I'm only 49, and if it can happen to me, it can happen to anybody. But I was at the right place at the right time, and surviving that, you just kind of look at the whole outcome as, do I have a second chance? Maybe I do.
In this area, what I've noticed, there is a very high incidence of heart disease, and a lot of patients I've noticed have symptoms of heart disease that are just not recognized at an earlier stage. One of the biggest things about Mercy is the Mercy Touch. So I enjoyed the patient-centered care aspect. The cardiologists at Mercy are a very special group of cardiologists, and so having cardiology here and having it so easily accessible is very important, because then we can provide timely care for patients so that they can have a good outcome and a longer life.
Mercy having its own heart program It creates a continuity of care. This allows the Mercy patients to stay at home and have their surgery and recover here. What I'm trying to bring here at Mercy is to establish a solid heart program first, and then gradually build on that to do more complex surgeries, so that we're not just a community hospital, but become a regional site where patients from other areas can come to have their surgeries here. Most people that have to have surgery do very well. If you have a very good program, you can expect to have open heart surgery and survive and live a normal life again. I mean, that's my expectation. Anytime I take someone to surgery, my expectation is you're going to come out of that operation alive, and you're going to walk out of the hospital and you're going to enjoy life again.